Hello everyone. Today I would like to present a case report on retinal vasculitis with branch retinal vein occlusion post COVID-19 vaccination. We have no financial interests. We all know that SARS-CoV-2 has taken the world by its worst, and vaccination holds a key role in fighting the pandemic. All the vaccines authorized for emergency use have been carefully studied and found to be safe and effective in preventing severe COVID-19 cases. Though a few ocular side effects post-vaccination have been reported, the exact incidence is still unknown. Let us discuss the case now. I present a case of a 42-year-old female, homemaker by occupation, hailing from Telangana, presented to the OPD with chief complaints of sudden onset diminution of vision in the left eye since 2 days and also associated with appearance of black spots in front of the left eye since 2 days. The significant medical history which she had given was she had taken a first dose of COVID vaccine 10 days ago, and she was a hypertensive since 13 years on treatment, and she was well under control. On examination, the unaided visual acuity in the right eye was 660 improving to 6.6, and in the affected eye, that is the left eye, it was 2/60 not improving. The anterior segment was within normal limits. And the fundus of the right eye, we can see a large pre-retinal hemorrhage temporal to the macula. Apart from what is seen here, there were superficial hemorrhages in the superior quadrant. In the left eye, the fundus showed superficial hemorrhages in the inferior-temporal quadrant and also exudates along with it. So it could be a differential of IT-BRVO and also along with macular edema. So we came to a provisional diagnosis of right eye superior temporal BRVO with pre-retinal hemorrhage and left eye inferior temporal BRVO with macular edema. The FFA showed presence of focal leakages and block fluorescence temporal to the macula in the right eye and in focal leakages in the left eye, which confirmed vasculitis. OCT of the left eye showed gross macular edema. We investigated her further, and she came for a follow-up with the reports and found that all the investigations turned out to be normal. So we came to a diagnosis of right eye BRVO secondary to vasculitis and left eye BRVO with macular edema secondary to vasculitis post-COVID vaccination. In the right eye, we had administered injection bevacizumab and in the left eye injection Ozurdex. And she was asked to review after 2 weeks. The vision was same, and we had proceeded with a sectoral laser in both the eyes. 1 month post the laser, the vision improved in the left eye to 636 and N12. And 1 month post that, the vision improved to 624 and N12. The macula was dry, so we did not intervene any further, and we asked her to get back after a month. Now the discussion. COVID itself can cause ocular complications. Post-COVID vaccine reported complications include episcleritis, angioscleritis, acute macular neuroretinopathy, paracentral acute middle maculopathy, and subretinal fluid. A study by Sain S. et al. Hypothesized that the vasculitis found in post-COVID infection patients could be the same mechanism as that found in vasculitis post-COVID vaccination patients. There are reports of vasculitis post-COVID-19 vaccine which have been treated with oral prednisolone and recovered completely, but they have not mentioned the hypothesis for the same. In reports of retinal vein occlusions post-COVID vaccination, they have been treated with anti-VEGF, but only mild or partial improvement was seen in these cases. To conclude, our case report adds to further reports of possible side effects with potential serious post-immunization complications of COVID-19 vaccinations. Ophthalmologists should be aware of the possible rare ocular adverse effects after COVID-19 vaccination.